My name is Lyle Young. My student number is 176311613, and I'm going to demonstrate the administration of an oral Schedule 8 medication. This is my ID.
Yeah.
Okay. Just washing my hands, reduce microbial load and prevent cross-contamination. I'm now reading the patient's notes and I'm identifying the need for administration of medication and to ensure procedure is being performed on the correct patient. Here we have Mr. Pitt, who presented to hospital post-trauma. He got injuries on the right side, ribs, abrasions and wound to the leg. Okay. Good morning, Mr. Pitt. I'm Lyle. I'm a third-year nursing student and I'll be looking after you this morning. How are you feeling today?
I'm in a bit of pain.
Okay. So, prior to me actually, you stated that you're in a bit of pain. Can you tell me whereabouts the pain is radiating?
Down my left side.
Alright, so if I gave you a pain scale, 0 being really good and 10 being really bad, could you tell me what your pain would rate about?
About 8.
Okay, so that's pretty severe. Okay, so I see that you've been written up for oxycodone today.
Yep.
And I will be administrating that this morning. But first of all, I need to check your ID just to ensure that I'm giving the right medication to the right person. So can you tell me your name?
Peter Pitt.
Yep. Can you tell me your date of birth?
1st of the 1st, 1945.
Okay, and I'm just checking this against the medication chart, which says it's Peter Pitt. His date of birth is 1st of the 1st, 1945, and his MRN is 123754.
Correct.
Okay, do you have any allergies?
I'm allergic to penicillin.
Okay, can you tell me what that does to you?
It gives me a bit of a rash.
Alright. And just to demonstrate that he has a red armband, which indicates he does have allergies. Okay. Score chart, and Mr. Pitt, while you take this medicine, you may feel dizziness, drowsiness, nausea, and a tendency to vomit, just to let you know. So it is important to measure and record vital signs, such as BP, pulse, respiratory rate and saturation rate, as well as temperature, to make sure that at this time Mr. Pitt can tolerate his medication. So I'm just checking the chart now. And it states that Mr. Pitt is within normal range for all of these. So this states that I can administer the medicine. So now I'm just going to validate the medication order with my second RN. So I just need to validate this with you. So we've got Mr. Peter Pitt. His MRN is 123754 as per his armband. He's male. His date of birth is 1st of the 1st, 1945. He's not been given any medication this morning at this point in time. He's been written up for oxycodone. And there is no signature to say that it's previously been given. Okay, he's also written up for paracetamol, which we will not be giving at this time. Okay, the oxycodone will be given orally at 7.5 milligrams. The indication is for pain. His prescriber is Dr. Brown, and he has signed and written his name here. It also states that he has allergies, penicillin rash, and it's for today's date. Okay, you agree with that? Okay, hands. Just going to read the notes. Notes state that Mr. Peter Pitt is a 72-year-old male who presented to hospital post-trauma with low-speed pedestrian. Car accident, patient walking across pedestrian crossing, car reportedly travelling at 40 kilometres an hour. He has injuries of fractured right ribs, abrasions and wound left leg. So patient is 72 hours post-admission. So I'm just going to introduce myself. Hi Mr. Pitt, my name is Lyle. I'm a third-year nursing student. I'm just going to be administering your medication, which is the oxycodone that's been written up for today. First of all, I just need to do your identity check. Can you just tell me your name?
I'm Peter Pitt.
Yep, thank you. Can you tell me your date of birth?
Yeah, it's the 1st of the 1st, 1945.
Yep, and your MRN, do you know it?
No.
Okay, your MRN is 123754 and
123754.
it adds up here with 123754.
Okay.
Okay, I need to do an assessment of pain. Can you just give me a score out of 10, 0 being really good and 10 being really bad?
Probably
Tell me
about
what your
an
pain
8.
is.
Probably an 8.
An 8, so it's pretty extreme.
Mhm.
And you know where it's actually radiating to?
Just on my left leg.
Okay, no worries. So it's important that I measure your vital signs, such as your BP and your pulse and respiratory rate and your saturation rate. So just to make sure that you can tolerate the medication. So I'm just going to check your vital signs. Okay, so your vital signs say that you're within normal range of everything, so that's really good.
Yeah.
Okay. So now that I've done all my first stuff, I'm just going to validate my medication order. Do you mind just checking it with me?
Yep, sure.
Okay. This is
Yep.
Mr. Peter Pitt, and he hasn't had his medication dispensed as of yet. He's been written up for oxycodone for today's date.
Yep.
And it's orally.
Yep.
And it's 7.5 milligrams twice daily.
Yep.
It's for pain. And it's been written up by a doctor and signed by a doctor.
Yep.
And I need to ask his allergies.
Yep.
Mr. Pitt, do you have any allergies?
Yes, I'm allergic to penicillin.
Okay, thank you. Sorry I didn't check that earlier, but I'm just checking it now. So he's allergic to penicillin, and it states that he has rash if he's given it.
Yep.
Okay.
Yep. Okay.
Now I'm just going to check the MIMS to check the safe procedures for handling oxycodone. So the purpose of the drug is to relieve pain. Mr. Pitt has left chest pain scaling 8 out of 10. His indication for medication prescribed is pain. The contraindications are allergic to endone, currently suffering from head injury, asthma, brain tumour, etc. Mr. Pitt doesn't have any of these. The recommended dose for an adult is 1 gram every 6 hours. Mr. Pitt has ordered 7.5 milligrams in 12 hours, so this is in the safe range. The administration is orally with a full glass of water after meals or with milk. The possible adverse reactions are dizziness, drowsiness, hypertension or constipation, also nausea and vomiting. The nursing considerations includes checking patient periodically to ensure that patient is not suffering any of these adverse effects, and by checking vital signs. If any of these signs do occur, I need to notify a doctor immediately. So I'm just going to clean my hands again.
Sure.
So now I'm going to the SA drug cabinet to collect his... just washing my hand to prevent cross-contamination. I'm just going to do the medication calculation, which is stock required over stock strength times volume over 1, which equals 7.5 milligrams divided by 5 milligrams times 1, which will equal 1.5 tablets I will need to get.
Okay.
Do you agree?
I agree.
Thank you. And now I'm just going to go to the drug cabinet. Just taking out medication. Pill cutter. Just looking at that as per the protocol.
Yep.
And ensuring it's locked. Okay, so now I'm going to do my first medication check. And I have my second RN that's going to check it with me.
Yes, I'm here.
Okay, so I just need to make sure that I've got the right medication. So we have endone, and we have there was 31 tablets in this bottle, and I will now take it out of the bottle to make sure that there is 31 tablets in it. So we have 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, 30, 31 tablets.
Yep.
And there's 31 tablets written there.
Yep.
Okay.
31 tablets.
Yep.
Great.
So now I'm just going to do my first drug check.
Sure.
Just put these back in. I'll just get my second RN to check.
Sure.
So that's the endone, and it's written up for endone, oxycodone, which is the same.
Yep.
And there is 31 tablets in this bottle, and it's 5 milligrams per tablet,
Yep.
and the expiry date is December 2020.
Correct.
Okay, so on the medication chart it says oxycodone, which is endone, the same thing, 7.5 milligrams BD. It's written up for pain. It's for today's date.
Yep.
It's to be given orally. It has a doctor's signature, and a doctor has written his name there. And it's at today's time.
Yep.
And there's nothing that states it's been given previously. And it's for Mr. Peter Pitt. His date of birth is 1st of the 1st, 1945. He's male. His address is 1 University Road, Sydney, and his MRN is 123754. He's allergic to penicillin, and he gets a rash from it.
Okay. Yep.
Okay.
I agree.
Thank you. So now I'm just going to take out the tablets that I require, which will be 1.5 tablets. So I'll take 2 tablets out, and I'll be cutting one in half. So there's 2 halves.
Yep.
I'll take one and put it back, and I'll take one and discard it into here.
Okay. Yep. I saw that.
Yep.
Okay.
Right, so now I'll put the 1.5 in here, that I'm going to give to Mr. Pitt,
Yep. Sure.
and I'll do my second drug check.
Great.
Okay. So again, we have endone, and the medication chart states endone, and the amount given is 7.5 milligrams. And this will have 29 tablets left in it now, as I'm discarding half one, and I have 1.5 to give.
Yep.
It's 5 milligrams per tablet.
Yep.
Expiry date is December 2020.
Yep.
Yep. And it's written up exactly the same to state that it's endone, oxycodone, it's for pain, it's to be given orally, it's for today's date, it's been written and signed by a doctor,
Right.
and there is no previous signature there to state that it's been given previously today.
Yep. Sure.
It's from Mr. Peter Pitt. The MRN is 123754. And the date of birth is 1st of the 1st, 1945.
Yep.
He's male, and his address is 1 University Road, Sydney, 2000. And
Yep.
he has an allergies to penicillin, which gives him a rash.
Okay. Great.
Do you agree?
Agree.
Okay.
Yep.
All right. Now, previous to me giving it, putting it all back, I'm just going to do my third drug check. So I'm just going to take this out of the bottle and make sure that there is still 29 tablets still in there. So I'll just do that now.
Great.
So we've got 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 28, and there's 29 tablets
29
there.
tablets. Great.
Just going to put that back now.
Yep.
And I'm just going to do my last drug check. So it's endone, oxycodone, it's 7.5 milligrams, it's given orally, today's date, it's for pain, it's been signed and written by a doctor, his name is there, there's nothing to indicate it's been given previously, no signatures,
Yep.
and it's for Mr. Peter Pitt. He's a male, his date of birth is 1st of the 1st, 1945, his MRN is 123754, and this is endone, which is the same as on the chart. It has 29 tablets left in it, and it's 5 milligrams per tablet. Expires on December 2020, which means it's within the normal date.
Okay.
Okay, do you agree?
I agree.
Okay,
Yep.
thank you. So I'm just going to put this back into the drug cabinet now.
Yep.
Okay, so I'm just going to write up the ward register for Mr. Peter Pitt, and it's for today's date, which is the 9th of the 4th, 2018. It's at 11 a.m. I've just written in patient's name, which is Peter Pitt. Amount given will be 1.5, and discarded will be 0.5. So the new balance will be 29.
Yep.
And so the name of the prescriber is Dr. Brown. Name of the person administrating it will be me, Lyle Young. And this will be where I put my signature. I'll just get my second RN to check it and sign it off. Okay, thank you.
Okay, great.
So now I'm just going to go back to Mr. Pitt and administer his medication. Okay, Mr. Pitt, I'm back. So, can I just do the second patient identity check before I administer the medication, please? Full name. Can you tell me your full name? Okay, and your date of birth? Okay, and your MRN is 123754. Okay. Do you have any allergies? What does that allergy do to you? Okay. So, Mr. Pitt is also wearing a red armband, which indicates that he has signs of allergies. Mr. Pitt is not allergic to oxycodone, which I am actually giving to him today. Okay. I will ensure that Mr. Pitt is in an upright position to ease the swallowing. So I'll just place his head up, swallow, and I'll just give him some water to help him swallow. Now I'm going to cleanse my hand to reduce any cross-contamination again as I'm leaving the patient. And I'm just going to finish up with Mr. Pitt. So thank you, Mr. Pitt. I'll be back in about 15 minutes just to check on how your medication is going and to make sure that there is no adverse effects. As the medicine goes into your system, you may feel some discomfort and drowsiness or dizziness. If there's any discomfort, please feel free to give me a buzz on this buzzer that I'm going to give to you now, and I'll come immediately. Now I'm disposing of the equipment appropriately to ensure safe and healthy work environment. Now I'm just going to complete the medication chart and ensure that it's signed, and get my second RN to sign it. And thank you, that completes my Schedule 8 oral medication.